Hi, and welcome back. We are going to continue our conversation by now discussing what we talked about as, or referred to as the directional migration of leukocytes. But really, this is just a long way of saying chemotaxis, right? Chemotaxis is crucial for the immune response. And with chemotaxis, we have chemical signals like chemokines, and these are going to work with components of the complement system. And also within the complement system, they're going to create this chemical gradient where the infection occurred or where the injury occurred. And once the signals have been activated, then the leukocytes now know. That they need to come and play, right? So the chemokine receptors on leukocytes, they have this ability to detect that the gradient is available. And once that gradient is available, the leukocytes are going to start to move quickly to adhere to the endothelial cells. And this is called adhesion and diapedesis. This is going to allow more migration through the vessel walls in the tissues surrounding the area of injury or inflammation. Now, once we have adhesion and diapedesis, then further migration of leukocytes can occur. Now, at this point, leukocytes move along the gradient. They follow the increasing concentration of the chemotactic agents, and they can now move effectively to the site of infection. So that is a summary of chemotaxis, or the directional migration of leukocytosis: chemical signaling, leukocyte activation, adhesion and diapedesis, and then migration of leukocytes. The next question asks you to recall the end clotting, or the end product of the clotting system. And what I'm asking you here is, so once you have the clotting cascade and everything comes to play, what is really going to cause that clot to occur? And so we have fibrin, right? We need fibrin, which is the protein that forms this mesh-like stability to form a clot. And so fibrin is going to help provide scaffolding, where now platelets and red blood cells can use the fibrin to form a blood, I'll say a plug or a clot. And this is the actual mechanism that's going to help stop the bleeding. Now, also, when we create this plug or clot, it provides a barrier against pathogens. And this clot will then further prevent the spread of pathogens to other areas of the body. So, really, we're trying to create a very localized environment for this immune response. And then lastly, and overall, fibrin creates a framework for healing. And what I mean by that is that fibrin is the matrix for the migration of other fibroblasts and epithelial cells that need to enter during tissue repair. Okay, the last um, area of focus that we'll review right now is the role of opsonins. Okay, now during phagocytosis, how do we know what pathogens to destroy, or which ones are the pathogens? Well, opsonins actually will enhance the efficacy of phagocytosis because they mark the pathogens for us. So it's like going into work and needing to figure out what we need to get rid of or discard. So instead of being the first person on the job to go through and decide, keep, throw away, keep, throw away, opsonins already did that for us. So opsonins do that. They will mark the pathogen. Now, this is a mechanism. So opsonins such as the C3b from the complement system, or we even had another example, antibodies like IgG. These are also considered opsonins. They bind to the surface of different microbes, and they let us know what we should do with them. And so then phagocytes recognize which of the pathogens have been opsonized, right? So that means that the opsonins have marked them. And they do this via specific receptors, like the complement receptors. And then this is going to help facilitate a period where pathogens are being engulfed and destroyed. And this is called phagocytosis. What's the overall outcome? Well, without opsonins, it'd be pretty hard and take more time to know what to get rid of and what to keep, right? So, opsonins will help to improve the clearance of pathogens and prevent further infection. All right, so those are the 7 questions I want you to consider prior to moving into the quiz next week, um, in terms of the area of focus regarding innate immunity. Let me know if you have any other questions. Otherwise, we'll talk soon.